Hello, this is Gary Franke with a quick overview of 2026 open enrollment for individual health insurance from November 1st to December 15th for January 1st start date. Achieve Alpha is now part of a Heffernan Insurance Brokers. Same people, same great service, just part of a bigger company. For myself, Tamara, Bree, and Melissa, you can give us a call or text message 425-802-2783. Just a quick disclaimer, this is an overview. Always look up everything on the individual carrier websites or the Health Plan Finder. This is what the Health Plan Finder looks like, getting a new plan or renewing. You want to go in if you have a current plan, click on Report a Change. Or if you're looking just for the messages, you can look up any letter you were ever sent in the message center. But to add us as a broker, you click on Find a Broker. There's no additional cost for us to be your insurance broker. We get roughly $20 a month per person for the individual plans themselves. There's just no additional upcharge. It's the same if you do it yourself or work with us. Put my name in, even if you're working with Bree or Melissa or Tamara. We're all part of the same group here. We can all access the account together. Click on Request Help, proceed, and we're good to go. If you need to, the Smart Plan Finder is not very smart. Always look it up on the individual carrier websites. And you can filter by clicking on the filter button. That's how you get to narrow it down to the different plans you're looking for. And here's what it looks like when you're trying to filter. If you have questions, we're here to help you out. This year, there's an average of 21% rate increase. It's a little deceptive because the average silver plan went up 40% or so. So people getting tax credits get 40% more tax credits and can get a gold plan for cheaper than silver. So you're not going to see a lot of silver plans on the health exchange unless your income is a little bit more moderate or lower from that perspective. But here's an overview, and you can pause these as you need to. In past years, the Cascade plans have the same network. If it says Complete Gold, Vita Gold, those are the better network. If it says Cascade Select, it is a smaller network. I generally don't recommend that, especially for Ambetter, but for LifeWise, it's a little bit better overall. Here's a few additional things that are being added for the year. The artificial insemination is only the really cheap version, like the turkey baster type of version that's a lot cheaper than the expensive version from that side of things. In 2026, we need to have your 2026 estimated income for 2026 years. If you end up making more or less, it'll adjust on your 2027 year for the previous year on your taxes. You'll get a 1095-A. There is a big change coming through Congress right now, and we don't know if the enhanced tax credits are going to get extended or not. If they are not extended, let's say a household of two, if you make above $84,000, you will pay the full cost for health insurance. If there's two people that are 60, and they make $80,000, they would probably pay about $700 a month. If they make $85,000, they'll probably pay $1,700 a month. So there are some other options out there, but if your income's going to be a little higher, either make if you can make a lot more or just make a little bit less. One way or another, we can't give accounting advice, but this is a general chart for general rules. We sell a lot of accident insurance in conjunction with an individual health policy. So here's an example with a friend of mine that went from a silver plan that was $1,400 to a bronze that's $1,000 and added an accident plan for $92 a month. His son literally hit his head on the fireplace a couple days after Christmas or after the new year started, and they got a couple $1,000s in the mail. If you're accident prone or have a high risk job, get an accident plan. If your kid's in football, just do it. It's so much better value. Here's just an overview of how prescription drugs work. You can slow down this as you need to. There are a lot of changes this year, and we're going to be going over those. Just pause the screen as needed, and we'll kind of jump through some hoops from that. The biggest one is Regence is going from covering all the hospital systems almost in the Seattle area to only Swedish and Providence, and then CHI around the corners as well. Here's the doctor networks, has changed a little bit. Regence has added polyclinics, so that's the one thing they did add. But this is kind of the changes for what is occurring in the year. There are 4 basic plans now instead of 3. They're adding in the Vital Gold, which I call like a Silver Plus plan because it's very similar to the Silver, but just a smidge better overall, just because the Silver plans are going to be super expensive this year. So Get a Vital Gold, for example, a 50-year-old on the Complete Gold is $1,086, $970 on the Vital Gold, $1,238 on silver, and the bronze is $734. So that's just an example giving you a real life. All bronze plans on the Healthplanfinder are HSA eligible, even if it doesn't say HSA on it. You can look that up, talk with your bank, or KeyBank does a good job with that, or a lot of times a financial advisor. Here's just another example of how the HSAs work. You can reach out to them. But here's the basic plans that are going to show up on the Healthplanfinder. Don't be surprised if the silver plans don't show up because they're just more expensive. There's no reason to buy a silver plan if the Vital Gold is a better option and cheaper. It's a win-win from that perspective. So just pause this and look at them. The biggest difference is the Complete Gold has prescription drugs covered for super expensive brand 3 and 4 up front for $100 flat instead of Vital Gold is after deductible plus $200. That's probably the biggest difference overall between them. And then the bronze is the bronze. They are covering specialists up front before deductible now, so that's kind of nice. Regions, as we said, their coverage is in Washington, Oregon, Idaho, and mainly northern Utah. For in-network, if you travel around the nation, the Blue Card PPO network will cover urgent care centers all across the nation. So this is a good option for people that want more nationwide coverage per se, if urgent care centers will work well from that perspective. But just be aware that your the independent doctors should be staying roughly the same, but Swedish and Providence are going to be the main hospital. If you go to one of the other ones, you can't go there next year, or there are doctors at those facilities. They are adding polyclinic, as I mentioned, so that's another big option there that's helpful. Ambetter is in 27 states that you can go to and seek in-network coverage, but they have a smaller network of independent providers from that perspective. The Ambetter Bronze is a smaller plan, a smaller network. Don't choose that plan. It's more the community health centers. It can work for some people, but just letting you know, it is not the same. I would rather get a Vital Gold with Ambetter than like a Molina Bronze at times because it's only about 12% more expensive. So you can get a much better plan for not a lot more from that perspective. Here's the different states where Ambetter has in-network coverage at. It says 29, but technically California and New York are not reciprocity where you can't go there for regular in-network. LifeWise is staying fairly similar for the year. They do not accept payments from a personal checking or LifeWise and Premera only accept payments from a personal credit card or checking account, not a business account at all, believe me. The Alpine Network is a Cascade Select. Just look them up on their website directly on LifeWise, or the LifeWise primary for the Cascade. Slightly larger plans, but then the plan designs are not quite as good. So we'll kind of go over that with you if you ever have questions. The Premera plans are staying very similar. It's the most expensive plan, but it's really good coverage for the network, especially since Regence is getting rid of some of their hospital systems. Kaiser isn't changing a lot. The Visits Plus plans are often better than the Cascade plans. So that's just kind of a heads up from that perspective. On-the-job injuries are not covered if you don't have L&I insurance, if you're self-employed. Technically, I haven't seen that ever happen, but just giving you a heads up. Molina Marketplace is not changing a lot. They're adding Virginia Mason. One big key to note about Molina Marketplace, they do not cover any coverage outside the United States. All the other carriers, if you're traveling to Europe and you have a major illness or accident, the other carriers will cover that. Molina has zero coverage for anything outside the United States under any condition. So that's just a big heads up about Molina. They're a good carrier, but just be aware. We also sell travel insurance. United Healthcare, they've stepped up their game with the different hospital systems. Their network is pretty good overall. It has a good network. If you do need psychological services, mental health, Premera, Regence, and LifeWise, and then United Health has a lot of those as well. So just giving you a heads up, Molina and Ambetter don't have a great network of independent doctors or like mental health providers as much, but that's just kind of how those work. Here's the four HSA plans for the year. You really don't need an HSA plan because there's essentially on the Regence Bronze, you'd have to pay the first $7,000 of everything. I mean, it's not a bad plan, but just get a regular Regence Bronze, and they're about the same price. There's the limits for the year. We can't give accounting advice, but those are what the limits are. HSA plans are separate from the individual health plans. I go to KeyBank personally. It's one of the last ones in person from that perspective. Delta Dental has exchange plans for adults and children. The exchange plan for adults does not cover any major any major services like crowns or root canals. For children, it's a really good plan. So if your child needs a lot of dental, it's a great plan, except for braces. So here, look below, you can see what it covers and how it covers as a general overview. If you get a direct Delta dental plan, if you have continuous coverage within 60 days, it does cover prior like major dental issues. If you don't, there's a 12-month waiting period. But they are more expensive because they do cover major dental. Here are the prices for the different plans along those lines. And if you buy a direct Delta Dental, get the Brilliance 200 if you do want a vision plan. It's better than the VSP Direct one, to be honest. Emeritus Dental is roughly half the price of Delta Dental. They have a 6-month waiting period for crowns, root canals, deep cleanings, any major services, even if you've had other dental insurance. But it is cheaper in the long run. It's only a one-time 6-month waiting period. So just a heads up from that perspective. The most popular one is a second one down, but they only cover roughly 70% of dentists in the area. So that's just kind of an overview from that standpoint. Here's the VSP plans. If you're going to use the vision plans, get one. Just make sure optometrist takes it. Otherwise, there's no coverage. This year, the cost share plans are going to be more popular just because if someone's insurance going from $700 to $1,700 and they can't do it, let's just say the husband has health issues and the wife is healthy, I don't recommend dropping coverage. We can never, recommend that, but this is something you can get instead. They're not great plans, but they do not cover pre-existing conditions. They're not insurance, but they cover medical expenses for new medical issues, and there are some waiting periods for up to 12 months or limitations on cancer and pregnancy and stuff like that. However, if you're a 60-year-old and your insurance is going to be, $1,000 a month, maybe you just get a Ruby plan for $136. At least it covers up to $150,000 in new medical issue coverage. So, I wouldn't buy this myself, but if it's better than buying nothing at all, I would do something just from that perspective. So just give me the caveat there from that aspect. But in conclusion, if you have any questions, you can give us a call or text message 425-802-2783. Have a great day.